everybody.
Hello.
So sorry, we're a little late logging on. We had some technical difficulties.
Again.
Yes, so Facebook has changed some things around for us, so you guys get us vertically today. So for anybody who doesn't know, I am Jamie. This is Dr. Colin Consales, and we are both from Integrative Health and Wellness right here in Greensburg. Every week we just kind of like to reach out to you guys so that if you have questions that you'd like to ask one of the doctors, you can do so here. If there are questions or topics that you guys want to learn more about, we would love to hear those. Just send us a private message and we'll see what we can do to get those to you. So tonight, I get to drill you on why people should come here.
Oh boy.
So it's really nice because, what I did was I took some of the questions, like the most often asked questions that I get at the front desk, and we're just kind of going to put them out here. If you guys have questions while we're doing this, just shoot them out to us, and we'll see what he has to say.
Okay. If I try to explain something and it kind of goes right over your head or you can't understand it, just let us know and I'll try to explain it a little bit differently.
And really, so I have a term for what you just said actually, and it's typically, can you just explain that in kindergarten terms for me?
Okay.
Right? Because sometimes he's so smart, honestly, that it really does go right over my head. But he's really good at bringing it down to a level I can understand. So let's go.
Okay.
All right. So the first question that I get a lot of times when people call in here is, do we accept insurance?
We don't accept insurance. Is that all you want to know?
No.
So the reason why is because insurance will cover basic, muscle stretching, work like that, and spinal manipulation or adjustment. And our treatments, whenever you need adjusted, it's usually going to take us less than 50 seconds to do so. What we're working on is wiring up the muscles properly so that the bones are being pulled properly by the muscles, and they usually slide right back in place. So very little neck adjustment and low back adjustment because those are kind of floating, and if you fix the muscles, they go back. And then more adjustment in the mid back area because they're attached to the ribs. So basically, the answer to that is insurance only covers certain things. Being that we don't accept insurance, we're not pigeonholed into treating only specific conditions. And we spend most of our time on the things that are going to help you rather than what insurance will pay for.
I have to say, one of the coolest things, I was a patient here before I worked here for almost a year. Mm-hmm. And I hated that you didn't accept insurance, but I love it also because I know other chiropractors, they're so strapped at what they can do.
Yeah. Because
the insurance companies, and you guys I love that you're just like, nope, not going to do that.
Yeah, and I wish insurance would cover all of this stuff, but truly insurance is linked up with medicine and it's medically based. So anything that is okay by them, they'll insure, and really what they say isn't all there is in the world. So there are a lot of other treatments that can be utilized to help you along the path to health and fix you a lot more quickly than what we'd be able to do if we were accepting insurance.
Which is super cool too from a patient standpoint, I think, because you'd make a lot more money here if we accepted insurance.
Yeah, it would be a whole different program, but it to me it would be boring, and I know in my heart I could do more for my patients, so I just couldn't do it.
So how much are visits then?
So visits are initial consultation exam, which would include the initial consultation exam, which is 45 minutes, and a bunch of other testing with that. And then the report of findings, which is the following visit, that is $280. And then our treatment visits are $55, and if you're under 18, they're $45.
Okay. And that is really affordable for anybody who's gone to a holistic doctor. Mm-hmm. But for those that haven't and are transitioning, into coming here, that could sound like a lot of money.
Absolutely.
So what are some ways that we make things more affordable for people to be able to come?
We offer, the major one I would say is that we offer a class weekly 5:30 on Wednesdays, and if you attend that class, you get a boatload of information. I mean, a ton of really, really helpful information, and we've geared it to giving you, positive and helpful advice to help you and your family be healthy. So you're going to learn a lot, but if you do it, we explain a lot of what we do and how it works, so it actually ends up saving us time during that examination process because we're not explaining everything to you. So if you come to one of those classes, you actually get 50% off of that initial consultation exam, making it $140. And if you are referred by a patient, then you receive an additional 15% off, so it would bring it down to $119 for the initial consultation exam. If you are a current patient, if you refer a patient to our clinic, then you get a $15 credit to use any way that you'd like here. So that helps current patients kind of move through and help, not only help their family, but help themselves financially.
So the other thing I love, and I know when I was coming here, I did three things called home health classes.
Oh yeah, yep. Yeah, we do those, and basically those are, you gather up your friends and family, at least 5 people there that aren't current patients, and we have a list of talks and topics that we can talk about. We have our general one that we do, which is great all-around information, but then we can get into specifics like thyroid health or weight or whatever you want, and talk to that group of people, your friends, family, or co-workers. And if you were to do that, everyone there would get the same discount as if they came here for a health class, would be 50% off initial consultation exam if they wanted to even do that. But if you did that and you were a patient, you would receive a $50 credit to our clinic to use any way that you'd like. And the reason for that is, in our purpose, one of our main goals is to educate, because there's a lot of false information out there, and in my opinion, if you're not educated on how something works or why something works or why something is even important in the first place to do, then you're never going to know, and you're kind of ignorant to that, and you're not going to get the help that you need.
So does somebody have to come to one of those Wednesday classes in order to be a patient?
No, absolutely not. It's up to you if you want to do that.
So I'm already stressing for you on this next question. So I'm just warning him, is what makes you any different from any other doctor?
I am no different. I just, the way that I treat is different in that we're looking at the whole body. So, typically if you're going the medical route, you're going to be told to go to a bunch of different specialists, and you're going to go to an eye, nose, and throat specialist, an endocrinologist, anyone. You have all these different a cardiologist, a specialist. But these men and women, they don't focus on the whole system, so they're looking at one little area of the body, not looking at the whole system and how it works together. So the benefit of what we do is we're looking at everything, and we're not treating a disease, and we're not treating a symptom. We're looking at the whole system as a system and the function of that system, and restoring the function of that system so that all of those other little subparts, like your sinuses or your heart or whatever it may be, they begin to function the way that they're meant to function. So you don't need to go to all of these other doctors and make a million trips everywhere and pay your $30 copay 3 times a week and end up spending more money than you'd spend coming here. We work to efficiently handle your situation without the use of drugs and surgery, and it allows us to treat you without any symptoms, and you would receive nothing here but benefits from our care.
So I gotta say, truthfully, you've said this to me numerous times, and I didn't fully get it until this week.
Okay.
Really.
What is that?
It's just that, I have something wrong with me, and I'm still, even now, it's been over a year that I've been coming here, and I call you and I say, hey, can you fix this, right? And you tell me, yeah or no, okay?
Yeah.
And then I would still think, well, but he's not, we are very trained to think of this specialist thing,
He's not
right?
a specialist.
He's not a specialist.
Yeah.
He really doesn't know. And I got it this week because something was wrong with me. And you didn't, when I would go to a specialist, they would do a lot of tests. It would take a lot of time to get these results back, right? And you really just found out that, okay, this symptom is linked to this, so there is something wrong. And instead of treating that symptom, this is it. You're fixing my body to make itself get rid of that.
Yeah, exactly.
It's like you're just making my body work the way it's supposed to.
Yeah, because a symptom is an alarm. So if you have a symptom, you could have 5 different symptoms. Instead of going to 5 different doctors, you can come here and we work to restore the function of your body as a system, and then all of those go away because a symptom's nothing more than a sign of dysfunction.
And that's so cool here, because then along with your treatments is that's one of the reasons our patients aren't constantly on supplements or medications.
Exactly, yep.
And so I absolutely love that, and totally just didn't get that until this week. So it's so funny how there are times in the office where he'll say to me, why do people accept that? Why do people think that that's okay? Mm-hmm. And it's because we're trained that way.
Yeah, it's kind of like a programming almost.
And it's so, and then when he says certain things like that, I go, I think in my head, well, why didn't I question that before? That really doesn't make sense. Mm-hmm. But we just don't know any different.
Yeah.
So it's a whole new way of thinking. Okay, so that's going to bring me to medications.
Okay.
Do you prescribe medications?
I do not, and I don't want to.
So, if I come here, will you take me off of my medications?
No, I cannot legally do that. But what I can do is I can correct the function of your body, and we can correct it so well that your medications will work so good that you won't need as many because they'll be doing their job so much better. And then eventually when you go for your blood work, which is what medical doctors do, they'll find that your numbers are different than what they should be, and they'll have no choice but to change the dosage of your medication, and until potentially you may no longer need your medications.
So then do you give blood work?
Don't need to do blood work, nope. So a lot of times what we find, so blood work is actually very simple. You go to get a thyroid test, unless they do a full thyroid panel, they're only looking at 3 hormones, T3, T4, and then thyroid stimulating hormone, for example, which doesn't show you or give you the big picture. Yes, you can do a thyroid panel, which would show you more information, but then you're not taking into account the things that the thyroid is communicating with via the hormone. So you have the pituitary, so that's where thyroid stimulating hormones release, so they are checking that. But there are other negative feedback loops where your body says, okay, if there's too much of this hormone, we're going to change this organ or gland around or decrease the function of it. Your body's doing it on its own. So if there's a endocrine organ or hormone gland that isn't working properly somewhere else, it can have an effect on the function of the thyroid, and it could logically make absolutely no sense from adrenal gland should never communicate with thyroid, but they do. They all talk together. So if they're all not working properly, you're not going to get, it's not going to show up on blood work, basically, that way. But with our testing, we can see everything, how well it's functioning, and attack the ones that aren't functioning the best and restore the function of the body. It's a little lengthy, wordy, I guess.
It's all good. We got a thumbs up on that one, so somebody liked it.
All right.
Yeah. All right. How long would you say somebody has to come here before they start seeing results?
Really, we're looking at the first visit. We want to show you results, especially if you're coming in with an ache or a pain, something like that, like a shoulder pain or a back pain. Usually we can give you relief the first visit, but that's going to be dependent on how chronic the condition is, what it is, of course how severe it is. And how long you've had it, and how well you can follow recommendations. So that is one thing that we look for. If you're willing to do what it takes, if someone's coming in with a very chronic, severe condition, we want to make sure that you're ready, willing, and able to do what it's going to take to change around what you need to change around in your life to get the results. And if you're not, and if you're just not ready to do that, then we may or may not accept you as a patient here.
I have to say, one of the coolest things about being at the front desk is the crazy things that I get to celebrate with people that you fix. So a lot of times we'll have a lot of patients who are suffering with constipation, and whenever you fix that, I get to celebrate that they pooped.
That's funny. I didn't know that.
Yeah, I know. I've not told him that.
That's a job perk, right?
Yeah, right. I'm like, the things we celebrate here. They're like, I pooped. I'm like, yay, yay. All right. So you do this thing called muscle testing.
Yes. Hey, Charles.
What is muscle testing?
That's one of the hardest things to explain. It really, really is, because people do it in so many different ways, and some ways are accurate and some ways are completely inaccurate. So how we're utilizing it is as a nerve response. So what happens is your body responds to things, and it can respond in a positive way and a negative way. Nerves basically have chemicals in them that either say turn on or turn off. So if you stimulate the body in a way that is not helpful for it, it's going to send a signal into the body to turn it off. So for instance, like one way that we test muscle is it's really tough to explain. So say we're testing a pec muscle on this side, and it's strong, okay? It's a strong muscle, but this side is weak. So one thing we could do to figure out is actually test that muscle and push on the arm and see if that pec muscle is weak. So that's one way. But if we couldn't test the arm or shoulder for some reason, we could actually pinch the muscle and test any muscle in the body to see if it's working right. And basically how that works is if you pinch a muscle that's not working properly, it's already sending pain signals into the body, whether you feel them or not. It's called nociception. And your body you only feel 20% of the pain signals being produced in your body. So whenever you pinch a muscle like that, it'll send pain signals into the spinal cord, and that'll flood the part of your spinal cord that controls all of your muscles with the turn off signal. And when that happens, any muscle in your body will weaken. So we can see, that's just one example of how we use muscle. It's a neurological response, and it's physiologically based. That's how we can see how different muscles are functioning properly or not functioning properly.
So in doing this, like, what ailments can you treat?
We don't treat any ailments. We restore the function, and almost all ailments have the potential to go away.
Okay, so what can you not help? And I'm asking this, and here's why. This is a great question, I think, for you, and I understand you're not going to be able to give me a list of things, but it's super cool because I have sent people here that you have decided not to treat. Why? That's probably a better question.
Okay, so a lot of times if someone so what we're doing is getting the body to function to its most normal state and its highest level. So if someone is missing a bunch of parts that have been cut out and torn out, like they're missing a bunch of different organ systems, we're very limited to what we can do there.
So keep your organ systems.
Keep your organ systems. That's a last resort, is to get them removed. But if you have had one or two removed, we can still probably help you. Another is if you have a really long list of medications. If you have a really long list of medication, a medication forces the body to do something. It's not its natural way of doing something, so it overrides the body and tells it to do something to change a symptom in the body. That's what a medication does. So it's not natural. If you have a bunch of medications, trying to find a way around all of those forceful, medicated, that they're forceful changes, I guess you could say, in the body, trying to find your way around that in order to allow the body to function naturally and normally is very difficult. So those are two things that we look for that are very difficult. May be hard for us to generate improvements for you. The last one is whether or not, depending on how chronic and severe things are, whether or not you're willing and able to do the things that it may take to get you to the point where you need to be.
So I love that. So you do the exam, people come in, they tell you their ailments, you do some uninvasive muscle testing on them.
Yeah.
And then, right?
Yep.
And then they come back for the consult, which I call the fun appointment.
Okay.
Because that's where you get to find out what the doctors think is causing your symptoms, and
That's the report, yeah.
Yes, and if they can help you, and it's so nice because you'll tell people right then and there if you don't think you can help them. It's not like you wait for months of treatments before you tell them this isn't a good fit for you.
Unfortunately, I had to do it just last week with a patient.
And it's so nice, I just have to say, like, from my point of view, that you just don't suck somebody dry for as much money or as many times as they're willing to come, without results. So that is so awesome. Okay, so how old or young are your patients?
I've treated mothers who were pregnant, mothers who couldn't get pregnant and then became pregnant throughout the pregnancy, and then their newborn baby. So that young. And then we've had our oldest patient. My oldest patient is probably, he sees me and my father, but he's my grandfather, who is 93.
That's awesome. I love it. We actually have oops babies that come in here.
Yeah.
Right? Because some of the patients didn't even think they could get pregnant, and just because they weren't even trying to get pregnant, but you guys got them so well that oops, they got pregnant. It's so cool. Okay, so I have to ask, for the moms out there, is can you, because I use you as a PCP, right? Like, my kids are sick, I'm sick, I come to you. Can I get a physical from you guys for my kids' school?
No, because if you look at the form, it says medical doctor, signed by medical doctor. We are DCs, Doctors of Chiropractic, and who do a bunch of other techniques. But yeah, legally they want someone who could prescribe drugs to do that. Okay,
and then we're actually starting to run a little bit out of time because I don't want to keep you guys here all night. So, what diet would I be expected to follow to come here? Because I know you guys use food a lot of times as medicine.
Yeah. It's going to be different for every individual. It just depends on how much inflammation you have in your body. So inflammation causes pain and sickness and disease. But generally we're looking for a diet that is, and this is all explained during our health class too, a diet that's a little bit higher in fat and good quality fats, and then lower in carbohydrate, and then a little bit more protein. So, and it's going to be dependent on you and your activity level and what you need. You know, if you're a heavy weightlifter or something like that, you may need more carbohydrate than someone who does not, because you're utilizing muscles that burn sugar for energy.
Is that what I need to do to eat carbs?
Pump iron.
Pump iron.
Maybe. And then, and then if you're, say for instance, if you're, a long distance athlete, those muscle fibers are going to utilize sugar, or not utilize fat and oxygen. So you're going to want to increase your fat and reduce your carbohydrate to train your body in different ways. So those are athletes, but for generally speaking, it's going to be a lower carbohydrate and reduce the grains and sugar as much as you can. And we work with you, and there are reasons why you may or may not crave those things, but that's just an all-around, and a lot of scientific studies are showing that is truly the best way to eat. And I know that there's always fat's good, fat's bad, and all this nonsense, but it's truly how humans have eaten since the beginning of time. So you want to follow ways that we've eaten and the ways that which our bodies are accustomed to eating, rather than fad diets.
So 2 things I want you guys to know. One is that whenever somebody does come in, you guys, neither one of you, Dr. Sarah, Vivona, or you, you don't just give somebody a meal plan to wake up the next day and just change everything.
That's a dietitian's job, and that we don't do that.
But you're good about saying, for me, for instance, I have a lot of inflammation in my back, and it was a slow process for me to give up carbs, a very slow, painful process for me. But I was actually getting ready to join a pain management support group until you helped me.
And now you don't have as much pain.
Right? I don't. I'm hardly in pain, and it's you and what you're teaching me with food. But I love it because you take me through steps. It's not just, you don't expect me to just change everything all at once.
And and you don't have to be crazy with militant style you eat this. It's not how we do it here. It's easy. You're more open to choose what you want to eat and what you like to eat. We just tell you what you personally would need to eliminate specific things or add to your diet, and you just incorporate that into what you're already eating.
The other thing I wanted to stress about the food thing too is that it's really cool because there's a lot of patients that come in for like thyroid issues or just some ailments that will prevent them from getting the results that they want as soon as quickly by doing a diet change. And you guys are really good about telling people like, no, I don't want you to change yet because you fixed the body first.
Exactly, yeah. So and that's what we used to do. We used to just have two separate programs. It was our applied kinesiology program or our nutrition program. But what we are finding is when we started someone on nutrition, that we work with their diet, extremely closely. And we started them out and actually had them on more supplements than what they needed if we started someone with treating them on a physical level and treating them mentally, emotionally. And it's actually significantly reduced the amount of supplements that they need to take because you're not compensating, you're not kind of like painting over rust. And we're still at the time that it's would be most efficient to do, we're then working with the diet. So once we have things working properly and your body's able to absorb what you need, then we give you what you need to basically restore the function of all your organs, and that's it.
So how often would I need to come as a patient?
Typically it's once a week, sometimes twice a week, depending on the severity of your condition, which is really different than traditional chiropractic care, which is 2, 3, even 4 times a week. So it's less treatment here. It's more efficient and exact to what you need.
And it's really cool too is that, your treatment starts off maybe once a week, and then as people get better, you stretch that out.
We stretch it out as far as you can go. So we then move to every other week, then every 3, then once a month, and we see at which point your body can handle at your current health level before you need help from us. And that's going to be dependent on your stability, how your body's stability is, and how well your organ systems are functioning from what our testing is showing, and of course how you're feeling. So everyone's going to be different. Some people we have coming in only once a year, and it's enough for them, and that's what we do.
And so how do I become a patient?
Give Jamie a call.
You gotta call me. It's 724-205-6260. You gotta call me. And the class every Wednesday night that you guys get a discount for coming to, it's taught by whichever doctor I don't have live with me. So Dr. Sarah's teaching that tonight. Kathy, we're so glad you're coming to a home health class to get some help. And Linda, thank you so much. I'm so glad that listening to us helps you. If any of you guys listening are interested in that class, you're more than welcome to come. We do have that class in our foyer, and space is limited. So we always ask that you reserve a seat just because it can get crowded and really hot, and we don't want the people who are coming to be uncomfortable, you guys.
Yep.
So you can go to our website, IHW Center, and you can just reserve your seat right there. You can give us an email. You can give me a call. And then, as always, you can private message us. We'd love to hear from you guys, and let us know what you think and if there's anything else you want us to discuss. Thanks so much for taking time out to join us. We'll see you next week.
See ya.